Hi everyone, MPP Jeremy Roberts here, and I'm here today with a very special guest, Ottawa's Chief Medical Officer of Health, Dr. Vera Etches. Vera, thank you for being here with me today.
Thank you.
We're going to tackle a really important topic today, and that's the topic of masks. And, there's so much different information out there these days that people are hearing on the internet, in the news about masks. And so I wanted to get a chance to ask you some of those questions that we hear here in our office quite often about masks, and maybe dispel some of those myths and some of that misinformation that's out there. So the first question that I want to ask you is, do masks really work? Because sometimes we hear, research or we see stuff on the internet that says that masks don't really protect us from COVID-19. So could you perhaps elaborate a little bit on that?
We have a lot of evidence that masks work. The first type of evidence we have is studies in laboratories looking at the physical barrier that masks provide. And there is a lot of evidence that the masks can stop the COVID virus from coming out from somebody who has the virus, and maybe they don't even know it, but in their speaking, in their, those particles are usually larger droplets that mostly can be captured by a mask. Sometimes there are smaller, even aerosols. Again, most of those can be captured by a mask, so it makes a big difference to how much virus gets out into the air when someone's wearing a mask to keep it to themselves. There's also evidence that masks, especially when they are medical grade masks and even fit tested for healthcare providers, they can protect the person who's wearing them. And that means that in those cases it's very much fitted to the face, and it prevents all of the particles from coming in. Of course, the virus has to reach someone's nose, mouth, or potentially eyes to be able to be transmitted. So the masks are an important part of that barrier.
Sure.
We do know also from the studies of when masks have become mandatory in different jurisdictions, how that's added to the protection and slowing down transmission in a whole population. So it appears very significant, very worthwhile. It can decrease the number of people who test positive at a whole population level when enough people are wearing masks.
Interesting. Another thing that we hear often from folks is, the advice seems to have changed on masks, that at the beginning of the pandemic, we weren't recommended to wear masks, and now we are. Could you perhaps explain a little bit why that change happened? Was there an evolution in the research that led to that change in advice?
Well, the idea of masks was first brought forward as an idea that you could wear one and be protected from getting the virus. And we know that the non-medical masks aren't perfect because they can, they're not perfectly fit to your face. They can enable a particle to come around the sides if they're not on properly. And that idea that you would be protected was something we wanted to be careful about. We didn't want people to think that they would be perfectly safe if they wore a mask. However, what changed was we found out that this virus is transmitted by asymptomatic people quite often when we don't even know potentially ourselves that we are carrying the virus, and when we're speaking or coughing or raising our voices, that could be a source for others. And so we really then found we need to make sure everyone's wearing a mask that's possible. Some people have contraindications, because it could be that everybody, is potentially a source without knowing it. And so that's a difference that prompted much more emphasis on wearing masks.
Okay, that makes sense. And the last question I had for you, and you touched on this a little bit in some of your answers, is, you hear sometimes that, these cloth masks don't really work, that it's only the medical masks that work, and face shields and cloth masks aren't actually, effective. Could you shed some light on the different types of masks and what the research suggests about the different types that are available?
Yeah, so there are medical masks that are going to be approved, as a barrier for use in medical situations like surgery. And then there are non-medical masks, and those can be cloth. They can be disposable, like the one I'm wearing. And in fact, we talk about 2-ply versus 3-ply. There's very very much a similar amount of protection provided by the disposables and the cloth, as long as there's 2-ply. And we're saying you can add to that with a 3rd layer. The 2-ply usually is like tightly woven material, and the 3rd layer could be something that's more of a synthetic barrier, a filter barrier. But in fact, the studies have been done comparing surgical masks to cloth with these different layers, and they're very comparable.
Excellent.
As long as they're fitting properly. So you have them over your nose, over your mouth, under your chin, no gaping at the sides.
So often you see people wearing it and they have their nose exposed, and I think, I'm not sure that's actually doing what you want it to do. But well, great. That I think sheds a lot of light on some of these questions that get asked to us so often. And so I think we can just conclude by encouraging everybody watching at home, as we go into the holiday season, please make sure that you're wearing your mask. It's doing a whole bunch to help make sure that we can keep this as under control as possible, and it's something that each of us can do in our own daily lives to help combat COVID-19. Thanks so much, Dr. Etches, for being with me today, and Merry Christmas.
Thank you.